Hello guys, welcome to my channel. This is Isaac, Simple and Real. Thank you for continuing to follow my channel. Thank you for the continued support, your subscription, your like, your share. I'm loving it. Thank you so much. Today we are starting it afresh. This is a new season and a new episode. In this season, we'll be talking more about sexually transmitted infections. Thank you for your continued support. May God bless you so much for supporting this channel. And even as we continue or as we grow to enlighten our community on more about health education and about averting HIV stigma in our society. Thank you so much. Thank you. And you have not yet subscribed to my channel, kindly do so. Subscribe, like, and share. Let more people be able to learn more about this channel so that we can be able to enlighten more people about these facts. Thank you so much. Today, I want us to learn more about gonorrhea and gonococcal infections. And to start with, I'd like us to know, or like us to ask ourselves, what is gonorrhea? I know that word is not very new to our minds, to our ears. We have heard more about gonorrhea. In Swahili, we call it kisonono. That word has been very popular, especially lately, when the media publicly stated of the super gonorrhea. Remember that? And it's very important that we get to know what is gonorrhea, how is it spread, what are the clinical significance, what are the complications that may appear if you're not promptly treated, and what are the signs and symptoms of gonorrhea. Thank you so much. Kindly follow me to the end so that you get to learn more about this kind of infection. Thank you. This is Isaac, Simple and Real. Let's go together to the end. Thank you. Gonorrhea, this is a sexually transmitted infection that is caused by a cocci bacteria that we call Neisseria gonorrhea. And this cocci bacteria usually it does not survive outside the body of human beings. So you may not be able to collect it on toilet seats, on chairs, or maybe on plates. But usually it survives well or it thrives well in either seminal fluids or vaginal fluids. Also, it may be able to exist in the lacrimal fluids, that is tears, and also in your mouth it can survive. So let's go straight to transmission. How do you get transmitted of this bacteria? As we initially stated it, it is a sexually transmitted disease, and therefore usually during coitus or during sexual intercourse, this is the main route where transmissions takes place. When you have sex or unprotected sex with a person who is suffering or who harbors this kind of bacteria, either he or she is symptomatic or asymptomatic, you may get this kind of bacteria to yourself. I know someone may ask, Dr. You have talked about this bacteria can thrive in your mouth. Now, how about the mouth? Usually, there are some of us or some people who have oral sex. When you are having oral sex, you'll be able to transfer the bacteria from either the vagina or the penis to your mouth. And this usually causes something we call tonsillitis. But kindly get me very correctly. Not all kind of tonsillitis is caused by Neisseria gonorrhea bacteria. tonsillitis can be caused by other kinds of bacteria, but even Neisseria gonorrhea can also be a cause to tonsillitis or pharyngitis, that is inflamed pharynx and inflamed tonsils. We are clear up to that point? Thank you. The other presentation or transmission that where we can get symptoms or can exhibit symptoms after transmission is the rectum. There are some people, as I said earlier, there are some people who have oral sex. There are others who also get anal sex. And these kind of people who usually have anal sex, either it's a heterosexual or homosexual kind of coitus. If a person or a male is having or the person who is the bottom in this kind of case, or the top, the person who is the top in this kind of scenario, if he is suffering from gonorrhea, he may deposit the bacteria in your rectum if you are the victim of the circumstance. And the presentation will be rectal discharge. Usually they are for smelling rectal discharge that usually a person who is having rectal gonorrhea infection will present with. Usually a pus-like discharge from the rectum, and also rectal irritation is one of the signs. The other one rather is not a sexual transmission, but it could be it's usually for the young children. Young children, when they are born vaginally by a mother who is suffering from gonorrhea, either asymptomatic or asymptomatic mother, they will exhibit a conjunctival discharge or eye discharge that is somehow purulent or yellowish in color, with swelling of the eyes, usually between 0 to 2 weeks after they have been born. The good thing about this is the healthcare workers or the doctor who is examining your baby will be able to diagnose this very fast, and it is treatable and curable. But if not treated, it may lead to the blindness of your child or permanent eye damage by this kind of bacteria. So it is very important for your child to be treated promptly and very early when they are born with this kind of symptoms. The other conjunctivitis is usually when people are having sex, and then there are those either vaginal or seminal fluids, and then if they are in your hands and then you get to touch your eyes, maybe you have an irritation in the eye during the coitus, and then you touch your eye with such kind of fluids, you may end up contaminating your eye and causing gonococcal infection in your eyes, which we call gonococcal conjunctivitis. The symptoms or the presentation is the same with the newborn. You'll start exhibiting yellowish purulent discharge with swelling of the eyes. It may be one eye, it may be both eyes, but this is also gonococcal infection. So it is also treatable. There are ointments usually given to you by a healthcare worker or the doctor who is examining you, who is treating you, and it's usually treated for about 5 days, and then you'll be okay. Now, someone may ask, now, what is the clinical or presentation or signs and symptoms of a person who is suffering from gonorrhea? Especially now, the STI. Now, for someone, especially, we start with the male. In most cases, males or men are the most symptomatic individuals when it comes to gonorrhea infection, and they usually exhibit their symptoms between 0 and 21 days. But usually, even within 5 days, most men start experiencing this kind of symptoms. What are these kind of symptoms? One of the symptoms when you are suffering from gonorrhea, you will have urethral discharge. That is, when you are expressing your penis or your glans penis or the most distal part of your penis, you will start experiencing some abnormal discharge. Could be yellowish or whitish kind of discharge from your urethra. Also, they experience a lot of pain while passing urine. The other presentation of a male who is suffering from gonorrhea, apart from the two, they may experience lower abdominal pain, and also in some cases they may experience testicular pain. Others, which are not very common, they may experience a lower back pain, and this usually occurs as the disease or the infection progresses untreated. How about the ladies? Most of the women who suffer from gonorrhea are usually asymptomatic. But for the cases that present with symptoms, they may experience vaginal discharge, which usually presents with yellowish or a bit greenish discharge. They may also be having a the discharge is foul smelling. They may also experience lower abdominal pain. They may also experience lower back pain. Some may experience spotting, while others may not exhibit this kind of symptom. So, these are just some of the presentation of a male and a female who are suffering from gonorrhea infection. As I said earlier, for those who usually have anal sex, with gonorrhea infection, they may experience rectal irritation. That is irritation. You feel like you're having long call, but you are really not having, you don't have anything to push out. You feel like you want to scratch at the rectum, yet you cannot reach your fingers there. And then you have some discharge like from your rectum. This is an indication of gonorrhea infection. For those who are having who usually have oral sex, it is very hard to be able to distinguish whether it is gonococcal infection or not. This is because there are so many bacteria that can present in a human body with infections of pharynx, that is pharyngitis, or tonsillitis, that is tonsils irritation. So it is very hard to make a diagnosis of gonococcal infection in the throat for those who have oral sex. But with a culture, a diagnosis may be able to arise with a specific bacteria of gonococcal infection. For the eyes, the conjunctivitis is usually clinical and is usually treated clinically, and not necessarily that the healthcare worker or the doctor will have to take you to lab for swab to confirm the diagnosis, because the presentation is usually it's not very like it's almost a high percentage is likely for gonorrhea infection. So It's very unlikely, but it may happen that a swab for culture may be done, especially if you exhibit some recurrence with the same kind of symptoms. Now, let's go to the treatment. I'll not go direct to specific treatments because there are various there are different types of antibiotics that are usually used in the treatment of gonorrhea infection. To begin with, a healthcare worker or doctor may decide to use the class of macrolides to treat you for gonorrhea, and it's very effective. That is example of azithromycin. The doctor may decide to use the class of cephalosporins. That is the example of injectable ceftriaxone or maybe oral cefixime. Or the doctor may decide to use amoxicillin clavulanate acid. That is a penicillin's class. So I may not be able to tell you the specific treatment that the healthcare worker is ought to decide. That is in accordance to the doctor's discretion to decide what to do. Let's go to the prevention. As we usually talk about HIV, we usually say that being positive about HIV is not necessarily being HIV positive. Remember, when you're having a sexually transmitted infection, it increases your chances of getting transmitted HIV by having unprotected sex to a double fold. Especially someone who is actively suffering from an STI has a double chance of acquiring HIV virus when he or she have sex with a person who is HIV positive and who is not on treatment. The other thing that I say, prevention is better than cure, and therefore let us go directly to the prevention. As we usually talk about HIV, we say condoms can prevent someone from getting HIV infection. Also, the same kind of condom, when you're having sex with a person of a non-HIV status, of a non-STI status, please, it's very advisable that you use condoms. This is also, we also call it a barrier method. It is very effective in preventing you from getting this kind of bacterial infection that we call gonorrhea. The other one, if you get signs and symptoms of any kind of STI, especially gonorrhea, please get immediate treatment either in your youth-friendly clinic or a comprehensive care clinic. We also call them CCC. They are usually free of charge, and if there are charges, they are a bit minimal charges for this kind of treatment. Also, we assure you of confidentiality when we are handling you. And also, it is also very important when we refer you to inform your sexual partner for treatment. It's very advisable. It's either we may give you coupons to give to your sexual partner so that they can come to our clinic, or if you are confident to do so, you can go directly and inform them or come with them so that they can get prompt treatment before they spread the disease to you again, or you get another reinfection after we have already treated you. Thank you for watching my channel. Continue subscribing to my channel and educate more people to be able to know about this channel so that they can get enlightened and so that they may not fall into temptation or the risk of getting infected and getting to this kind of complications. Let's go to the complication as we wind up this topic of the day. What are the complications? When you don't treat acute conjunctivitis caused by gonococcal infection or gonorrhea, especially to the newborn, it can lead to permanent blindness. For the rectal, it may cause tenesmus, that is that kind of irritation or urge to defecate, which is not happening, and which can cause rectal soles, which may cause severe sepsis, especially when feces are passing through. The other one is for women who are suffering from gonorrhea. If the infection is not treated early, it may progress up to the oviduct and cause a pelvic inflammatory disease, which is treated on a long-term basis. It is not easily cured. The other worst thing is infertility, which is caused by irritation of the oviduct and which may result even to ectopic pregnancy. So this is a great risk if you're not treated promptly. The other one, especially for men, it may lead to orchitis, that is, or epididymitis, that is inflamed testicles and inflamed epididymis. These are kind of the complications that may result if you're not treated promptly and on time, or if you do not complete your treatment. Thank you for watching my channel. Kindly do not forget to like, subscribe, and share. Let more people be able to learn about this channel so that we can be able to educate more people in our nation so as to live a more healthy life. Thank you. This is Isaac, Simple and Real, or you can also call me Mkurugenzi Mash. Thank you for watching my channel. Bye bye and God bless you.